Good morning, everybody. My name is Oonagh Gilvarry. I am the Chief Research Officer in HCI. This morning's session, I'm going to spend a little bit of time looking at the HIQA report that was recently released, which related to a review of the monitoring of the IPAS services in 2024 and looking at the inspection findings and some of the key areas of focus that HIQA identified during their first year of the regulatory framework implementation. So what I'm hoping to do, the report itself is quite sizable. It's over 100 pages. So we want to try and take some of the key information that's contained within it. We want to try and utilize it to identify some of the key areas of focus that we need to look at to drive continuous improvement in our services. And then we're going to consider some of the central actions or outputs that you should have in place to ensure compliance as you move forward. Just before we get into the nitty-gritty, a quick summary about HCI for those of you who may not be aware. We help providers of health and social care services to make intelligence-driven decisions to attain, manage and improve quality, safety and regulatory compliance. And we do this through streamlining, improving and transforming internal processes with a focus on ensuring safe, quality services for residents. We're well over 20 years in business now, and we have in excess of 40 staff with a range of experience across the health and social care disciplines. Just before we get into the report, and I'm going to talk a little bit more about these at the end of the webinar, we have a number of services in place, and these services have been developed in response to the needs of the IPAS services that are out there. And as you embark on your regulatory compliance journey, there are a number of processes and elements that we can assist you with. And also I'm going to be joined later on by my colleague Louis Coyne, and he's going to talk a little bit more about our knowledge library and how we can ensure that that knowledge and understanding of your requirements internally are communicated throughout your organization. So as I said, Louis will spend a little bit of time on that just towards the end of the webinar. So let's talk about the report itself. So very recently released just on the 5th of March this year, and this is their one-year overview report of the monitoring inspection of IPAS centres. And that monitoring and ongoing review is something that we've been doing in HCI. As each of the IPAS inspection reports are released, we take some time to review and consider the findings and identify some of the key areas of focus as we move through the compliance journey with IPAS services. Now, there's some very positive aspects to it. I mean, in their communications, they said the findings of the inspections are very encouraging, which is good. And they've identified that there are some service providers that are really delivering a really high quality, safe service and that have been able to achieve full compliance. So they're trying to bring, obviously, everybody up to that level. And the provision of this type of report is really very useful to all services within the sector. So what is the aim of it? Well, they want to present us this information, and it takes some time and effort for them to put it together, but they want to present those key areas for improvement to try and support you to have a more targeted approach at your local level to have a consistently safe and effective service that complies with these national standards. And it's looking for us then to take the information and focus our efforts in that regard. We've seen it within other health and social care services where they move towards thematic type inspections where they see there is a particular area that there are some weaknesses or that people are struggling to achieve, and that they drive the regulatory process towards that to try and drive continuous improvement throughout the service. Now, the report also contains a number of issues and elements that require attention from a national or government level. We're not going to look at those today, but they do recognise that there are areas of improvement from a national level also, but we won't spend too much time on that today. Just in relation to the data or what they have pulled from, as we know, the inspections kicked off in this time are January 24, and they've carried out 60 inspections of 51 centres. And at the time of the report being released, there were 45 accommodation centres under the legal remit of HIQA, providing over 7,500 beds. The inspections by type is pretty close split, 50-50 in relation to announced and unannounced, a couple of short notice ones, which would generally be driven by particular communications or concerns for a particular service, but it would be reflective of other health and social care inspection elements of 50-50 announced and unannounced. Just before we get into the drilling down into the themes and the related standards, I just want to do a quick summary of the feedback that was provided in relation to the services, both from a children and adult perspective. HIQA's approach to regulation has changed over the period of time, but certainly more and more they're looking for the residents' voices to be really central to their inspection process. And I suppose they're looking to services to also ensure that the resident voices are central to your processes and drive your improvements internally. So it's really important just to take a little bit of time and do a quick summary. There's a lot of information in the report about it, but I've just broken it down into a shorter summary. So feedback from children first, there was a lot of positive aspects, a lot of children and young people expressing that they were generally happy with their lives in the centres, good facilities in many centres with games rooms, football pitches and study areas. There was a lot of focus on the educational supports for there. They liked going to school. There was good feedback in relation to participation in local sports clubs and community events. The majority felt safe and secure in their accommodation, knew who the centre manager was, and were comfortable speaking to them if needed. So very positive elements in the majority of services. Some of the more challenging elements are something that they're looking for us to drive some improvement on. Again, depending on the facilities, in certain facilities, children had to complete homework on the ground. There was a lack of table space and they didn't have access to the play areas required. Privacy and accommodation issues came up with some children disliking having to share their bedrooms and wished for more personal space. Understandably, some children found institutional rules frustrating in certain cases, particularly in relation to not being allowed with sleepovers or external activities with school friends. Food and catering was something that came up quite a bit, particularly for catered services, with children being dissatisfied with the lack of variety or quality and limited access to meals and snacks, or the snacks between meals. Something that's certainly very central to all of HIQA inspections is in relation to safeguarding. It's something that they will always touch on in pretty specific detail within their inspection processes is in relation to safeguarding. Although while most children felt safe, 21% felt that they didn't know who to talk to if they were unsafe or felt unsafe or worried. And 16% felt the centre was not a safe place for children. So safety is certainly something central to our considerations. Many children felt that they weren't adequately consulted or given the opportunity to provide feedback, and we'll see this coming through on the adult feedback also. Again, giving voice to our residents is very important, be they adults or children. And again, some issues in relation to education resources. Surprisingly, about 15% of the school-age children were not attending school, but in many cases that was due to recent relocation, so something just to keep an eye on. From an adult perspective, then, I will just do a couple of quick reviews. Positive feedback, good feeling of safety, especially where there were security personnel present, good support from staff and local communities. So good integration with the communities, access to services and creating stable lives. General satisfaction rate pretty good, 83% stating they're happy living in the accommodation centres, and good positive staff interactions, which is really, really good to see. Residents found staff members easy to talk to, helpful and respectful in their interactions. Some of the areas looking for improvement, consultation engagement is central. So ensuring that we have those resident forums, the feedback mechanisms, the comment boxes available to ensure that residents are actively engaged and consulted on how the centre is being managed. So they did feel that the engagement by manager specifically was in certain cases mainly through email, and that they weren't aware of those residents forum. It's really important, I think, as well that senior management team are seen to be engaging directly on a one-to-one basis with residents, so that there is that open method of communication that they're looking to see. Human rights then, many residents were not informed about their rights or how local practice impacted them. 40% felt that there were restrictions on their daily lives, which is understanding to some degree. And from a privacy and living conditions, obviously with those sharing sleeping arrangements, they found that that was restrictive and lacked in their personal space. Food and catering came up again. Again, for catering centres, a lack of variety or quality of food, restricted meal times was a concern, and they felt there was a loss of independence where there were fully catered services. Complaint mechanisms is a really important tool for getting that information and feedback from your residents, and being able to actively engage with it and drive improvements. While 87% of the residents were comfortable, 22% were unaware of how to do so. That's really too high, and we want to try and make that to drive that number down. And then in certain cases, residents believed that the complaints weren't actually leading to changes. So it's one thing to have a listening mechanism, it's another to actually do something about it. And then that safeguarding awareness, while 88% felt safe, 15% were unaware of how to raise concerns, and 30% could not identify the designated safeguarding officers in their centre. So that's certainly something that should be and can be addressed quite easily within the service. Okay, we're going to get into the non-compliance trends and drill down a little bit more and see what what information we can gain from that, and look at some actions in addressing that as we move forward. As we know, HIQA and generally in their model of compliance, they break up the elements of the national standards into particular dimensions. So we've got capacity and capability, and our quality and safety. And when we look at the capacity and capability one particularly, and we look at the level of non-compliance, under the capability and capacity dimension, there's significantly higher levels of non-compliance or partial non-compliance in this theme than there is in the quality and safety theme. And this again is a pattern that we would have seen throughout the health and social care services as they come under that regulation framework. The reason for that, understandably, when services are under regulation, they move towards ensuring compliance in the direct person-centered elements, the one-to-one care. What sometimes happens, though, is that the focus on the governance model, the management, the structures, the framework to support the overall structure is left to the side, and takes a little bit longer to come in. And that's understandable too, where people have to try and build a general understanding of what is a governance framework, what is going to provide us with the structure and model that we need to have in place to ensure a safe, effective service. So if we look at that, I said like 75% in relation to contingency and planning, which is specifically in relation to risk management. That's a really high non-compliance level. So we're going to drill down into these, look at some of the particular standards and see where we can identify some of the findings. So from the governance, accountability and leadership, so we can see over 40% being either not compliant or partially compliant. So if we drill down into the individual standards, we can see quite high levels in relation to the functions per regulation. So the understanding of individuals of their roles and responsibilities as per the standards, high levels of issues in relation to leadership and governance, and again, monitoring and review. And monitoring and review, we'll spend a little bit of time talking about. It's always something that is a little bit late coming and that services really struggle to try and implement. So we'll look at some of the non-compliances. First of all, leadership gaps. So they found the service providers in many cases had low levels of understanding of the overall regulatory framework, what it means. And you have such an overload now of documentation that you wouldn't have had previously. Yes, you had your national standards, but now you have your judgment framework, you have your guide, your HIQA guide in relation to the monitoring. There's a lot of additional information. You have to also look elsewhere in relation to the national policies are there, say like the national policy for safeguarding. There's a lot more coming in on top of the services. So trying to get a handle on what are your roles and responsibilities in senior management in relation to the regulatory framework can be challenging. Providers didn't seem to have the knowledge or expertise to ensure compliance. And again, that's understandable within quite a new regulatory model, that there's a little bit less expertise in the application of the requirements. They found there was inadequate governance frameworks in certain services without a clear, effective and sustainable government arrangement in place. So looking for that framework or model that we can support our service provision on, and that there was poor or no formal reporting mechanisms in place. And we'll look at that in a little while. Lack of oversight. As I said, monitoring is always so challenging. Service providers having no or inadequate systems or monitoring or oversight. Typically, these centres also lacked the forming reporting mechanisms, and the roles and responsibilities of staff were not clearly defined. And they found that in this case, decision making within the centres was not transparent or consultative. So it was individuals that were making decisions in relation to the services rather than a more consultative forum. Two of the indicators with the highest levels of non-compliance: has your annual review been completed, the quality and safety of service? 86% of those carrying that they're detailing that they did not have it in place. And has the service provider a quality improvement in place? Quite high at 53% not having it in place. So if we just look at theme one, what are some of the actions we need to have in place? What do we need to do to try and drive a higher level of compliance in relation to theme one? We need a robust governance model. We need to have responsible individuals that are clear on their roles and responsibilities within the regulatory framework. So we need to make sure that those job descriptions that we have in place are clearly defining it, and that the experience level of those individuals will fit the bill in that regard. We need to have a good organizational chart in place with clear designates in place. And this is really important. And this came through a lot from the nursing home where we had the COVID-19 expert review panel, where we had one or two individuals carrying a huge amount of roles and responsibilities in relation to the regulatory framework. And when those individuals were taken out of the process, then the whole framework fell apart. So they look for strong designates to be in place to be able to step up into those roles and responsibilities should that individual be unable to attend. Teams and committees, we need a structured model in place. Who are the teams and committees that we need to have in place to ensure that the regulatory requirements are being implemented? There needs to be terms of reference in place for those teams, agendas in place, and that the meetings are maintained and there's follow-up on the actions that are taken. And then we need that process for resident involvement in service decisions. We need the voice of the residents to be central to our governance model. How are we doing that? How are we engaging them in the process? Do we have the forums in place, the comments, suggestion box? How are we bringing the voice, and what are we doing about that voice when we get it? Reporting mechanisms. So how are our processes in relation to issues that are arising within the service? What's our incident and adverse events process like? Our complaints management, and what's our active response to the information that is coming out of our service? From a monitoring perspective, and this is always challenging, we need to have a really robust audit schedule with effective auditees in place that are independent of the audit that they're completing. We want to implement it, we want to report it, and we want a quality improvement plan in place. One of the most comforting factors for any HIQA inspector that they come in, if they see a robust internal audit schedule and process in place, they know that you're actively driving to seek out those areas that require improvement. So they know that you're taking responsibility for driving the process rather than, as we said, the NCT model of sitting back and just let's see what happens, let's see what HIQA says, and then we're going to do something about it. They want a proactive approach in that response. Having your audit, your annual quality and safety review done, and having walkarounds from a management perspective. They want to see management being actively involved in the process, and that people know who you are, and that there is a real tangible approach to management within the service, and that there's an understanding of what's really happening on the ground, and we're not just somebody that's up in an office somewhere else. That's probably the biggest theme. I know I've taken some time on that one, but we'll move a little bit more quickly now through them. Responsive workforce. So again, 40% between the non-compliant and partially compliant. So let's drill down into that. Recruitment being by far the biggest standard, carrying the highest level of non-compliance at 35%. But we can also see there's concerns in relation to supervision and training if we combine the partially and not compliant percentages. So some of the non-conformances, unsafe recruitment practice by a long shot being the significant concern. It's one of the key issues that HIQA have pulled out within their overall review of the information that we have to address and we have to get right quickly. So they felt that there was inadequate or no recruitment policies and procedures in place, that we don't have defined processes and how we manage that recruitment process. Issues regard the vetting, international police checks, or employment references, and no job descriptions being in place. So no clarity on the roles and responsibilities throughout the organisation. Obviously, staff inexperience being a concern without relevant qualifications and experience in place, and that is an evolving process in that regard. Supervision was something that came up quite a bit in a lot of the individual inspection reports, where service providers could not be assured that the staff members were being well supported or being held account for their day-to-day practice. And again, that's hand in hand with those job descriptions. If I don't know what I'm supposed to be doing, I can't be held account to in relation to that. But the support that's required for staff members is central also. Lack of training. So no formal staff training programs in place, or else limited core training in critical areas. Safeguarding, so important that we have a really comprehensive model of training for safeguarding, cultural awareness, and our emergency response. And again, a lack of continuous professional development. And that can often be left on the back burner when we're putting models in place for staffing, but it is central to that continuous development and improvement processes with our services. One of the indicators, a sample staff records reviewed, how many were appropriately vetted. 35% not being appropriately vetted, that's a pretty high number. So we need to make sure that we can drive down in that regard. So actions, theme 2, how can we improve our compliance level? We need to get our policies and procedures in place. We need to make sure they're comprehensive and reflective of not only of the requirements in relation to IPAS, but also of the national legislation that is there. So we need to know how we're going to recruit, what experience we're going to look for, how we're going to manage induction and orientation. It can be an overwhelming change for individuals. We need to make sure that they're appropriately inducted and that we have performance reviews in place. The training plans are central. We want to lay them out from an early stage. What are our mandatory training requirements as per job type, and our ongoing training requirements as we move forward? How do we train people on our policies and procedures? How do we communicate the information within those policies and procedures, and also communicate any changes as they arise? And that's something that Louis is going to talk about towards the latter half. And our training records, are they robust? Are they detailed? Are they reflective of actual case? Supervision, really important. Do we have a schedule of supervision? Do we have sign off for competency for key areas? And are the records in place? In lots of places, people are doing really good work in relation to our services, but the records just are too poor, that they're not robust enough or detailed enough to be able to reflect the good work that's being done in services. The contingency and planning one really is just the one standard, and that relates to risk analysis. And as you can see here, massive, where we look at 75% either not compliant or partially compliant. Now, again, this is something that would have been reflected in all of the health and social care services as they move towards a more robust regulatory framework. And that is because there is a general lack of understanding about what risk management is about. How can I address it? What does it contain? What does it involve? So from their perspective, in non-compliance level, they felt that services had limited or no systems in place to identify, assess, and monitor risk. They had a lack of fundamental understanding of the process or responsibilities. A lot of the services just said, oh, health and safety, we'll just drive all of those through, but had no process in place in relation to person-centered risks. And then the risk reporting systems. How were we able to manage the information that's coming out of our service and incorporating it into our risk management model? So indicators, does your risk register have all the relevant risks? 70% of them did not. Are all our staff members in receipt of formal supervision? 69% in relation to that. So what do we need to have in place for risk management? Your risk management policy and procedure is really critical. What does it need to have? It needs to detail how you address corporate risks, how you address service and care risks, so your general care provision risks on your day-to-day basis, how you address your health and safety risks, and then how do you address your individual risk? And that runs in conjunction with our theme 10, which is our linking to our special reception needs. So our individual risk management process is really central to theme 10, which I'm going to spend a little bit of time on a little bit later. So we need to make sure that we have a really robust, and it takes, it's like eating an elephant, and it can be very overwhelming when we try to embark on a really comprehensive risk management model and framework, but it is something that we need to work away at and get good guidance and processes in place to be able to integrate it, because HIQA do require a very high level of compliance in relation to risk management. They are looking for a proactive response to risk, not a reactive one. We need to get ahead of the problems. We need to know what the problems are, or we need to know what those risks are, rather than, again, sitting back and waiting for them to identify them on our behalf. So that's the summary of, as I said, the first of the dimensions, those capacity and capability. Certainly a lot of work is going to be done on this in relation to the HIQA's approach, as when they come into the centre, the first people they're going to want to talk to are the senior management team. They want to see there's a general understanding of this regulatory requirements and your engagement with the overall process. So it's certainly a lot of focus in that regard. Now we're going to move on to quality and safety. 7 themes here. I'm going to have to move through them quite quickly, but we can see from overall, if we even just look at that graphic, much lower levels of non-compliance or partially compliant. So we're doing a lot of good work in relation to this area. 2 key areas, I suppose. Theme 10, that identification, assessment, response to special needs. That's certainly an area of focus, and it has quite a high level of non-compliance, and safeguarding protection. They're the ones that we certainly want to keep an eye on. We'll drill down a little bit. Accommodation is not bad, 20% between non-compliant and partially compliant. If we look at, there's a lot of standards in relation to this. Areas, I suppose, of concern: privacy and accommodation. Unsurprisingly, that's quite high in your non-compliance. Homely accommodation is something that we should be able to address quite easily. Quite a high level of non-compliance at 9% there. So let's drill down a little bit more and look at some of the key non-compliances. Lack of policies and procedures for accommodation. Significantly, this was across the board the biggest problem, where we had no policies or procedures that detailed how we allocate rooms, or where they did have it, the residents were certainly not aware of how accommodation was allocated, and they felt that there was a lack of transparency in relation to that decision-making process on allocation of accommodation. And again, that's going to have to work in conjunction under theme 10 with your special reception needs, but there needs to be a comprehensive approach to allocation of rooms. Overcrowding, provision of unsuitable cramped living conditions and quarters, limited storage, and bathroom facilities that could not ensure privacy. They're kind of some of the key areas. Restricted family accommodations in certain services where there was inadequate space for children. Now, poor maintenance of hygiene standards came up a lot, and really this is something that we can certainly should be able to address. They found unsanitary conditions in shared spaces, kitchens or bathrooms facilities being insufficient, unhygienic and unsafe living environments. That, I mean, they're really going to identify that that is unacceptable in that regard, and in certain ones, ineffective security in place. Highest indicators: is there a clear, fair, transparent room allocation policy? 51% no policy in place. Are residents accommodated in accordance with their identified needs? 16%. So work to be done in relation to driving down those compliance. So what do we need? We need a comprehensive accommodation policy and procedure integrated with the admission process and the special reception needs. We need to have a really effective audit process in place to on an ongoing basis, review the privacy and dignity requirements and develop action plans in that response. Again, an audit process in place for our cleaning and ensuring that we have a cleaning schedule that's appropriate to the capacity within our facilities and reflective of best practice, and making sure that we have sufficient laundry resources available. Food and catering, then, pretty good. I mean, by the overall, I know there was a lot of feedback we saw from children and adults in relation to food and catering, but by general, not bad from compliance level in that. So over the two, we can see quite low levels and quite high levels of compliance in that regard. Some of the areas of findings: restricted access to food or storage facilities, time restricted, limiting a residents' ability to cook, limited equipment being available for cooking and having to share these resources in overcrowded conditions, poor quality of food supplies, little consideration of the ethnicity of residents, and the most one to be addressed, catering services failing to meet required food hygiene standards. Again, that is not going to be tolerated. In certain cases, food being served cold, undercooked, or past its expiration date. So we need to make sure that we have policies and procedures in place for our food, dining and catering that incorporates evidence-based best practice on food safety requirements in that regard. We want to try and involve those residents on our related decisions, particularly in relation to food. This could surely is something that we can integrate quite easily and utilize expertise that's available. So we may have to look externally to try and draw in individuals to give us that information that we need to ensure a high quality service and ensuring those food standards are impeccably implemented. Person-centered care, we just have the residents, this is the rights and diversity of residents being respected. Again, pretty high level of compliance. We'll drill down into some of the concerns. Residents' consultation and participations, we can see that that's coming through in a number of those themes. Residents' views not being sought, a lack of structured mechanisms for that resident feedback, leading to decisions being made without input. The overcrowded conditions we've covered already, in certain cases, then the situation being wholly inadequate and impacting on residents' lives. Restricted autonomy and decision making. So some centres exposed, they felt excessive restrictions on daily lives and these rigid schedules for meals, curfews and limited access to communal spaces. They felt that that was excessive, with residents feeling they had little control over their own living environment and spaces. So what do we need to do? We need to make sure that that resident engagement process is really effective. That resident forum needs to be managed appropriately. Surveys being completed, comment box being completed, complaints, making sure that we have models in place for both verbal and written information. We would always say in relation to complaints, it's a gift if we can get it, if we can get that information and do something about it. What is the most frustrating for residents or service users throughout health and social services is where they provide feedback and they feel nothing is done about it. So we want to make sure that we have really effective, proactive responses in that regard. Individual, family and community life theme 7, again, really good levels of compliance in this regard. Some little issues in relation to standard 7.2, the public services. We'll just have a quick look at that. In certain services, there was limited access to local service education employment opportunities. Some residents faced transportation challenges, and then others felt that there were language barriers and a lack of English classes or interpretation services. So again, quite a small number in that regard, but we need to make sure we have those comprehensive policies and procedures to facilitate, integrate and communicate and make sure that we communicate these to all the residents. There's such a vast array of community supports that are in place. We need to make sure that we draw in that information and ensure that we communicate it out to the residents that we have on site. So engaging with those external supports and then involving the residents in the transportation schedule and ensuring that it's addressing the needs that they have in place. Safeguarding, as I said, is always an area of particular focus for HIQA. So again, we're pushing over the 30% being either not compliant or partially compliant in this regard, because they will be quite forensic in their analysis of these standards. So we can see protection against abuse and neglect, 6%, 7% in child protection and 6% in non-compliance in adverse events, but quite high also in adverse events in relation to partial compliance. So there's some work being done, but more work required. So if we drill down a little bit, failure to implement effective safeguarding policies. So in many cases, although there was good work being done in relation to protection of the residents, we didn't have comprehensive policies in place. And specifically, we weren't incorporating those national policies. So the national policy for safeguarding of adults, all of those need to be incorporated in policies and procedures. It's not good enough just to tick the box in relation to what the national standards say. We need to look outside of that and draw in evidence-based best practice in that regard. Staff training not being adequate or comprehensive enough in relation to child protection and safeguarding of vulnerable adults. Weak or inconsistent reporting mechanisms. So not having a process of real clarity of what we do if we have a safeguarding concerns. So a lot of cases, these went unreported and therefore unmanaged. And then these weren't being effectively documented or reported to external agencies. And then educating our residents about safeguarding process, again, providing them with the information to make sure that they're aware of how to report any concerns that they might have and who can they approach for help. Really important that they know who that designated liaison person is. They also, under safeguarding, incident management falls under this. And they felt that service providers did not pay adequate attention to incidents and adverse events. And this, again, a continual focus throughout the health and social care regulatory agencies. So they hadn't effective systems in place to review the incidents. Where there were incidents, they didn't learn anything from them. So the same incidents kept happening again and again, and there were no improvements made. And they felt there was general poor record keeping in this regard. So what do we need? We really need a very robust safeguarding policy and procedure with those national policies. How do we identify vulnerabilities? What are our protected disclosure mechanisms? How do we report it, both by residents and staff? How do we escalate it? How it's escalated within the organisations? How we can take learnings from it, and how we can engage with affected residents. It's a really, really big chunk of change in relation to that safeguarding policy and procedure. Make sure we train the staff on our internal processes then, and communicate those requirements out to both staff and residents, and make sure we have an effective incident management process that is feeding up information into our senior management team. Wellness and promotion, I won't spend too long on that. Really good levels of compliance under that. There's a couple of issues in relation to increasing the focus to access external services, a lack of proactive engagement, possibly about the supports that were available, looking for more information and better dissemination for our residents, and some increase in community and NGO engagement, but pretty good levels. Now, I just want to spend a couple of minutes on theme 10, our identification, assessment and response special needs. So again, obviously of under this dimension, it's certainly the biggest levels of non-compliance or partially compliant. Where is that? Policies and procedures, certainly a big one. What is it, 50% there of issues, 60% falling under the non-compliant and partially compliance level. Issues with the reception officer also being central. So let's have a drill down. The lack of reception officers, and I know it's a challenge throughout the service. Providers failed to appoint a qualified reception officer to oversee and respond to special reception needs, leading to inadequate identification and response to vulnerabilities. There was a lack of qualifications in place for others. We had no policies and procedures placed for certain service providers. So there was no direction or process to be able to manage from information coming from IPAS originally into your admission, how you assess, how you follow up and manage external referrals. So all of that needs to be incorporated into a defined policy and procedure. And in many cases, although good work was being done, no documentation was retained. So there was a real lack of documentation to be able to reflect the work that was done. Limited training to support staff in identifying, responding to special needs, and no engagement with those external services. So a failure, no referral process, and then a failure to notify government agencies about the changing needs of residents in this regard. What do we need to do? Well, we need to make sure we have appropriately experienced reception officers, and that is a challenge. I am well aware of that. We need comprehensive policies and procedures. So as I said, management of the IPAS information from the outset, how we work it through admission, assessment, management, referral, and ongoing review. And we need to make sure we have a defined process for each of those, and then make sure that our staff are adequately trained in identifying and responding to those special reception needs. Indicators. Were there policies and procedures in place that enable staff to identify, communicate, and address special reception needs? Over 60% did not have those in place. And was there cultural competency training in place? 59% did not have that done. I'm not getting into the HIQA recommendations, certainly not in relation to the national ones, but just to flag up what they consider the most important. What a surprise. More responsive, effective governance and management arrangements are required at national level. As I said, our local level. When they go in, it's the top that they want to talk to, and they want to have, as we would say, they want to have that warm, fuzzy feeling that the guys at the top and the girls at the top all know what they're doing. They have a clear understanding of their roles and responsibilities in relation to the regulatory requirements and ensuring a safe, effective service for our residents. They're looking for a more robust system for the identification, assessment, Management and escalation of risk, that's a big one. We need to have that comprehensive model in place. We need to have a robust monitoring system at local level, making sure our audit process is in place and effective in that regard to drive continuous improvement. And it's looking for all staff to make sure that they're appropriately vetted and they are asking from a national level the limitations from adult-only attention or accommodation to require review. So I'm almost at the end. As I said, that's the overall 10. We've talked a little bit about them. Those that dimension, capability and capacity, we need to get active on that and start driving through our actions for to ensure compliance as we move forward. As I mentioned at the very start, HCI have a number of services in place, and we've been working with IPAS services over the last period of time, working towards achieving a real compliance and not just about compliance, to ensure that we're providing the best possible services that we can for the residents. So we've completed gap analysis against the standards, also incorporating all of that guidance and evidence-based best practice. We've reviewed the models and made sure there's the robust government systems in place, and developing that beautiful risk management program that ensures that robustness from a corporate, service, health and safety and individual perspective. We provide education and training and also an audit program. We have a full suite of policies and procedures in place that addresses all of the requirements and evidence-based best practice. And this is something I'm going to bring in Louis for. We have a digital solution in relation to how that information can be communicated out to your staff members, and ensuring that they have information just in time. And that's our knowledge library and Clodagh. So I'm going to hand over to Louis. He's just going to, if you can just give us a couple of minutes of your time, I think it really will be of interest when you can see how we can communicate the actions that are required by your staff and ensuring that they're implementing your services appropriately. So Louis.
Thank you very much, Oonagh. So if I just share my screen here. So thank you very much, Oonagh. That was a very comprehensive overview of the report. I'm going to touch on a couple of areas, what we can really support, and some of the themes that come out from that, such as the responsive workforce, communication and accessibility in theme 2. So this is our knowledge platform. This is my IPAS demo environment where I've uploaded all of our relevant policy and procedure templates. We have them split out into those different 10 themes, so you can delve further into the policies and procedures related to each of those themes. So first of all, it's a documentation management. So you have full audit control over each of the different documents, the active date, the review date. I can look at here and see who the author and owner is, and I can also set all those revisions. So as you can see, these are all active, they're all in date. We can see what the revision number is, and you can only distribute those most active revisions. So you know your staff have access to most up-to-date information because you will have control of that documentation. The second thing we have is we can distribute and communicate that information. So if there is a change to a policy, you can push that out and it'll be sent to your staff members to acknowledge, review, and read the policy. So here you can see under my profile, I have a number of documents that are for acknowledgement. For example, my child supervision. So when I click on the document, it will pull up that information, the revision number, all the information that will be listed in here for me to review. We can implement a quiz. So not only can you demonstrate that your staff have acknowledged and understood the most recent documentation, we can also force that a quiz has to be asked as well. So for the moment, I've just got to acknowledge this. I've got my information saying I confirm and read and understood the child supervision document. We can work with you to edit that terminology, so you're sharing that out. So I'd work my way through reading these, completing the quiz and demonstrating that I understand the information along with the rest of your colleagues that will be distributed to. We can split them up between your head office, your corporate, your different themes, if you have any front of line staff, we can segment them into different areas. So if I just look at my analysis for a second and we go through my documentation acknowledgement, we can see we've got 92% are still outstanding, 8% have been acknowledged, and we can drill down further into these to see exactly Who is it in terms of the copy holders that haven't acknowledged that documentation when it was issued, when it's acknowledged, and you have a full audit history around that as well, including the export capabilities. So if you ever got a subject access request in the future, you can demonstrate that your policy was in date, it was the correct revision, and everybody who had responsibility or had to be aware of that policy had signed and acknowledged it. We can drill this down through my filter to look at department, documentation type, the standards or regulations that it falls under, and right the way down to the individual. So if I just select my own name here, you can see that I still have these outstanding as well. So very importantly, it's about getting that information, the communication, the accessibility, and having your staff aware of all that information at the point of care delivery or when they're dealing with the individuals that you support. So secondly to that is our Clodagh. Clodagh is your AI assistant who supports the accessibility and interrogation of your policies and procedures when and where they're required. So for example, I'm going to ask Clodagh a quick question here about what are the mandatory training requirements. And Clodagh will look at your policies and procedures. She will not go anywhere outside of what's been approved and will review your documents and pull that information within seconds for the individual asking those questions. So here we've got the mandatory training requirements include 7 key elements that all staff must complete, etc., related to legislation, complaint management, risk management. And here's the documentation that it's actually extracting that information from. So I don't have to go and read or find a policy that's 30 pages long to pull out exactly the information I'm looking for. Clodagh has analyzed it and provided that info. So if I then say, tell me more about point 5, she then will delve further into that specific point and provide more information for you when and where it's required. So this is really supporting your staff to have access to the most relevant information. It's compliant, you've been reviewed and it's documented, and they have it at that point of care delivery when and where they need it. The second thing that is really important about Clodagh, and again, it's down to understanding for your staff. We know we have a very diverse workforce in Ireland providing care, and I'm sure it's the same in the IPAS centres. So I've got, how do I report a safeguarding concern? I've translated it to Ukrainian. So I'm copying this in Ukrainian, and I'm going to ask Clodagh in Ukrainian. She will then interrogate the policies and procedures that have been approved in your environment. She's not looking outside of your environment and is going to provide that information back to the person who has asked the question in the language they've asked for. So Clodagh is multilingual, but as you can see here from a safeguarding concern, she is pulling it out from 2 specific documents that have been approved, which is security and use of CCTV and my safeguarding policy and procedure. And then if I, after asking the question, want to read that document, I can then go in and export or review the whole document to find all the information related to safeguarding that's been approved. All your documentation will have its signatures, its approver, its owner, and so on will be listed there for you as well. So really, really important for those themes that Oonagh touched on in terms of the communication of your policies and procedures, how and when and what you should do, who you should contact, and so on. But importantly, accessible to your staff through a mobile device at the point of care delivery. So I'm a top level admin here, so I get to do all the documentation management, but your frontline staff will just have the library and Clodagh and access that info. And just to show you what it would look like on a mobile here, as I didn't at the start with the screen, is you'd have the knowledge, it'd be scaled down to this size, and you can easily interrogate each of these, asking Clodagh the questions, providing that information at the point of care delivery. So that's all I'm going to run through today. If you want to have a further or deeper look at the system, please don't hesitate to get in touch. And I've just got some of our information here as well. So over to you, Oonagh.
Thank you, Louis. Well, I hope everybody was very impressed with that. I certainly was. I think it's an incredible use of a tool, particularly again in an environment that is constantly under change. I mean, there are going to be revisions, particularly in relation to the HIQA guidance and changes that are required for you to incorporate within your policies and procedures on an ongoing basis, which is understandable within, as said, such a fresh regulatory environment. So, the ability to be able to get that information out to your staff that quickly and have it that accessible is incredibly useful. So thank you for that, Louis. And that brings us to the end of this morning's session. I hope that you found it useful. I hope there was some information that you can take away and apply to your services. And at any stage, please feel free to drop us a line, make contact with us. Particularly Louis is available at any stage to bring you through some of our service provisions, and he'd be delighted to do that. But up until we see you perhaps not too long in the future, we'll have another webinar coming your way. And thank you very much for taking the time. And we hope you enjoy the sunshine today, wherever you are. Thank you.